Hello everyone, this is Dr. Sarosh Siddhapati from the platform of UKMLA with DSS, and let's just continue our success course for the UKMLA 2 exam. Okay, so in this lecture, what we are going to do is that we are going to study the basics of psychiatry. Okay, and psychiatry stations are like really important. Okay, you will always have one psychiatry station in your exam, and it's kind of get challenging to manage a psychiatry station and get the structures of the psychiatry stations all right, because there are 6 to 7 different type of psychiatry station that shows up in the exam, and every different topic, every different station have a different structure, have a different way to go about it, all right. So what I'm just going to do is that throughout the lecture, I'm going to cover each different type of psychiatry topic. It's going to include schizophrenia. It's going to include depression, eating disorders, suicide risk assessment, somebody coming with drug dependence, somebody having hypochondriasis or somatic disorders. Okay, so 7 to 8 different topics, having all of them having different structures. Then there is a case of cognitive decline as well, dementia. Okay, all of it would come under the banner of psychiatry, and we're going to discuss how to go about it one by one. Okay, but before I jump onto the cases and before I start discussing each case one by one, there is a very important thing that I would like to share in the psychiatry station. Okay, that is the non-verbal clue. Okay, this is something that is like very common in the exam, and not just in the psychiatry station, but the non-verbal clues are often seen in the abuse stations as well. Okay, so the psychiatry station and those stations in which you may be dealing with an abuse, you may see the patient giving the non-verbal clues. Okay, and if you're not aware of it, you would not be able to identify it in the exam. Number one, and number two, you wouldn't know how to manage a situation like that. You wouldn't know how to make sure that you identify the non-verbal clues and further proceed with it, because the candidates who are not aware of it, the candidates who do not have an idea how to go about it, what they end up doing is that they are constantly just requesting, and they constantly end up just asking the questions, and they wouldn't get any answer from the simulator. Okay, why? Because the non-verbal clues are often seen in a patient who is uncomfortable, the patient who may not be very relaxed, may not be very comfortable in talking about the situation. Okay, so until unless you do not make that patient comfortable, until unless you do not reassure that patient is not going to open up. And I have seen it, that has happened in the GMC exam as well, and it has happened in my mocks as well, that for 5 6 minutes they just keep on doing the effort to make sure that the patient opens up, make sure that the patient opens up, but the patient wouldn't open up because they are not identifying the non-verbal clues in the right way. And if they're able to identify it, they do not know how to make the patient open up. Okay, so it's a very important skill that you're going to master after today's lecture. Okay, so let's just discuss what are the possible non-verbal clues. Okay, so the non-verbal clues would be, it can be facial expression, it can be body language, it can be some gestures and some movements that maybe like not very giving a not very comfortable vibe, or it can be some vocal cues as well, that the patient may say something or may say something in a particular way that might be showing that okay, this patient may be uncomfortable. Okay, so let's just discuss all of them one by one. Okay, so the facial expression is very important. Okay, the patient may be frowning constantly like this, or the patient may have a raised eyebrow and a tensed facial expression. Like this is a normal facial expression. Okay, if somebody is constantly like this and doing this and constantly avoiding any eye contact, constantly giving an impression that oh my god, I'm feeling very nervous, I'm feeling very nervous. Okay, and the patient is acting like this and constantly doing this. Okay, you gotta understand that okay, if there is some frowning, if there is any raised eyebrows like these, And if the patient is not making eye contact, let's suppose you are sitting right there in front and the patient is constantly looking down and not making any eye contact and just nodding the head, not like answering your questions properly, okay. You should understand that, okay, this is a particular non-verbal clue, okay, and then there is something wrong with the patient, okay. Then sorry about that. Yeah, then the body language, okay. The patient will have a very defensive body language and a defensive posture, like, and what is a defensive posture? Like, for example, if I'm confident, I'll be sitting like this, okay, like leaning forward, okay, and I would be very confident, my shoulders would be upright, and I would be having a straight neck, and then I'll be talking to you in confidence. But if I am not confident, if I am uncomfortable, if I am going through something or the other, I will have a very defensive posture, like this. I would be leaning back, okay, my shoulders would be dropped down, my neck would be not straight, it would be like bent downwards. Okay, so this kind of posture is a defensive posture. Okay, somebody is if doing like this, shoulders are down, head is down, there is no eye contact, and the foreheads are is also like very very disturbed, and the eyebrows are raised, and somebody giving a picture like this, not making any eye contact, okay. So if somebody is doing that, it shows that, okay, they are having a defensive posture, they are not very comfortable, they may be going through something that should be explored, all right. So it is like a very very important thing that you need to learn to identify, okay. Other than that, then come some gestures, okay. The patient may be giving you some gestures, okay, like for example, they might be clenching their fist, okay, they might be making some hand gestures, okay, that would show that they're getting uncomfortable, okay. Then they might be constantly rubbing a particular area, like this, okay. And then they might be just showing some restlessness, uh, and tapping the fingers, okay, or they may be just moving their legs, like the one who moves it in the restless leg syndrome, okay. So all of these things needs to be identified. Somebody may just be scratching their head, somebody might just be doing this, holding their forehead, holding their head, covering their mouth, covering their face, okay. So all of these things are also the non-verbal cues, okay. And then comes the vocal cues, okay. They may be very reluctant, and they may be very hesitant to talk, okay. They may not talk very comfortably to you. Like for example, if I am slightly in my defensive mode, then if you ask a question to me that, okay, Mr. Adam, can you please tell me, since how long have you been feeling this tiredness? So I'll be like this, that mm, yeah, yeah, doctor. Mm, so it's been a couple of it's been a couple of weeks that I've been feeling very tired. Mm. Yeah, doctor. So it's been a couple of days now. I don't feel well. Mm, yeah. You see, not speaking very confidently, hesitating before they speak, or speaking too softly, or speaking in a very, very, shaky voice. All right. So somebody, if somebody is showing any of these characteristics, okay, it's either the facial expression, like avoiding eye contact is one of the very common non-verbal clue. Most of the people, they may not be sitting in a defensive posture, but they just would be avoiding eye contact, okay. Some of them may just be looking at the back of the room, constantly, because they don't want to face the healthcare provider, okay. Make sure that you're identifying it. You check if the patient is nervous or not, okay. If the body language of the patient shows that the patient is nervous, crossed arms, okay, and a defensive posture, like it's very very important to identify. I just showed you what a defensive posture is, okay. Then constantly fidgeting, okay, leaning away from the healthcare provider, or leaning away from the doctor, okay. Very common non-verbal clue. They will just give you a sad look as well, then touching or rubbing a specific area, clenching the fist, okay, constantly tapping the fingers, okay. All of these things are like the non-verbal cues that commonly shows up in the exam. And then the vocal cues, like speaking very slowly, very softly, being hesitant in speaking something, then constantly clearing the throat, okay, uh, before speaking. So all of these things, it's important to recognize all of these clues, okay. So this is the very first part, okay. Once you've done recognizing, you've already done the like half of the part that is important when it comes to the non-verbal clues, okay. Now what to do when you have identified that, okay, this is a particular non-verbal clue, okay, and you're going to see this in either the psychiatry stations or the abuse stations, okay. Now once you're done with that, now there is a three-step approach, okay. If you do not follow this three-step approach, okay, if you just end up follow just one out of the three things that I mentioned over here, then the ones that I'm going to teach right now, you still would not be successful in making the patient open up, okay. If you just offered the first two things and not the third thing, then again it wouldn't be enough. So you have to offer all of these three things, and in a very very nice, in a very very diplomatic way, okay. If you don't do that, then it's unlikely that the patient will open up. And then after the exam you would be coming to me and they'll be saying that, doctor, the patient did not open up for the first 6 minutes, and I did not get a chance to do the data gathering. I did not get a chance to identify what the disease was, and I'll end up failing this particular station, okay. So make sure that you follow these particular steps, okay. Now what is the first step in this? That's first of all, you need to acknowledge that, okay, there is some discomfort, okay, and this is called as validating the feelings that, okay, Mr. Adam, I can see that things are difficult for you. I can see that there is something bothering you right now. I can see that you're not being yourself right now. Is there anything that is bothering you? I can see that you are uncomfortable. I can see that you are being a bit anxious. I can see that there is something disturbing you at the moment. Okay, so first of all, if you've identified it, if it's there in your head that, okay, this is a non-verbal clue, then vocalize it. Okay, acknowledge that, yes, I can understand that this may be a difficult situation for you to talk about. I can understand that it's kind of difficult for you to open up about something that may be bothering you inside. Okay, try to comfort the patient. Okay, this acknowledgement is very very important to comfort the patient, okay. Then create a safe space, okay. And how do you create a safe space? By offering that, okay, this is a safe space, okay, and by showing that your body language is such that this is going to be a safe space for the patient, okay. And how you're going to do that? Use a very calm tone, okay. I understand that, okay, this is something that the patient is not opening up, your time and your clock is ticking, and there's a lot of pressure inside you that, okay, I need to make the patient open up so that I can do the relevant data gathering, and then I can move on to the management, because there's just so much to do. But make sure that you take the step by step approach, okay. Be very calm, that I can understand that you're going through something. Let me tell you, Mr. Adam, this is a safe space and I'm here to help you, and trust me on this, everything will be okay, okay. And if you share whatever is going wrong with you, if you share whatever is bothering with you, I'm going to try my best to help you in the best way possible. I'm going to find a solution for you. Together we are going to talk about it and make sure that we find a solution to whatever is bothering you. And trust me on this is a safe space. You can talk about your concerns. I'm going to help you address all your concerns, but for that you would have to cooperate with me a little bit. Just open up and just let me know what is bothering you. I may have a solution for your problem. Trust me on this, everything is going to be okay. I know it might be very difficult for you. You might be fighting some internal battles right now, but let's just do it together. Okay, so be very nice. Okay, use a calm tone. Okay, your body language should show that, okay, you are being supportive. Okay, you are there to help the patient. All right, and the patient still wouldn't open up, okay. you have acknowledged it, okay, you have offered the safe space, okay, you have offered the support as well, okay. Then there is a thing called offering confidentiality, okay. A lot of tutors say that you need to offer the confidentiality not once, not twice, but thrice, okay. They don't go with the formula of acknowledging safe space and then confidentiality. They think that it's just confidentiality, 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 but no, that is not the case. Before the confidentiality, it's acknowledgement, creating the safe space, and then offering the confidentiality just once, okay. If you are following the right protocol, if you're doing the first two things right, then only one confidentiality would help you open up, and only one confidentiality would be enough to make sure that the patient opens up to, okay. And how you are going to do that, you're going to say that, okay, let me tell you, Mr. Adam, whatever information we discuss here would remain private, and it would only remain between you and the medical team, okay. And it would remain confidential between you and the medical team, okay. What mistake a lot of candidates end up doing is that they say that this information is going to remain confidential between me and you. That is not true, okay. If you just end up saying me and you, or you and me, then you're doing it wrong, okay. Because of course, like, you are a junior doctor, if you are able to diagnose it, if you are able to identify something, you're going to go to the senior doctor and you're going to share this particular thing with them, that, okay, doctor, I had a patient, Mr. Adam, he was presenting with this psychiatric concern. Then how is it confidential between you and the patient? You're going to go and ask the nurse to draw the bloods of the patient who may be schizophrenic. Then how is the information, and how is the information that the patient has shared with you confidential between you and him? So always, the choice of words is like very, very important. It's going to remain confidential between you and the medical team, okay. That is the confidentiality they want, okay. They don't want you to just go out there and share it with their relatives, because psychiatric patient is already on a back foot, okay. They may not have the insight about the disease, and in the outside world, people are not very supportive of them. They may be thinking that there is something wrong with him, he's a weirdo, okay. All of these things would be going inside the head of the patient, okay. And they just want to have a safe space, and they want their information to be confidential, and that is why they have come up to you, so that they can open up to you without being having the fear of being judged, because of without having the fear of being called a weirdo, okay. So make sure that you offer the confidentiality, okay. And only once, okay. This is a poor logic that you have to offer confidentiality once, and then if still don't happen, then again offer confidentiality, then again offer confidentiality. It doesn't make sense at all to offer confidentiality three times, okay. What you need to do, the three steps, not the three times confidentiality. This confidentiality is the last step of the protocol to make the patient open up. The first one is acknowledging the discomfort, okay. That is the very first step. Then the other one is creating a safe space, okay. And the third one is confidentiality. If you do this right like this, okay, if you identify, acknowledge, offer a safe space, and then offer confidentiality, trust me on this, I can like guarantee you that the patient will open up within 2 minutes, okay. The patient will open up within 2 minutes if you're doing this, okay. But if you're not doing this correctly, okay, let's suppose you haven't acknowledged it, okay, you just noted that, okay, there is a non-verbal clue, and automatically you just offered confidentiality without acknowledging, without validating his feeling, then you're not doing it right, okay. Even though you're offering one of those things that I mentioned, but you're not doing it in the right way, okay. And then after confidentiality, you're offering safe space, and then you're saying that, yeah, I can see that you are in distress right now, so order is messed up, okay. If you do that, then you will have some difficulty in making the patient open up, okay. And let me tell you, psychiatry history is like very detailed. There are like a lot of questions that you need to ask in the psychiatry stations, okay. And as soon as the patient opens up, the better it is for you, okay. You cannot expect the patient to open up in 4 or 5 minutes, and then also expect that, okay, you're going to do the entire data gathering in 1 to 2 minutes, and then you'll be fine. No, you shouldn't be spending more than 2 minutes on the introduction, rapport building, and acknowledgement and identification of the non-verbal clue, and making the patient open up, Okay, first 2 minutes the patient has to open up. Okay, if the patient is not opening up, then you are doing something wrong. Okay, you're not acknowledging it correctly. You do not have a, maybe you do not have a very supportive tone. You're trying to offer a safe space but not in a supportive tone. Okay, maybe the way that you are saying it, it's not comforting enough for the patient to open up. Okay, so all of these things, it needs to be kept in mind when you are making sure that the patient opens up on a non-verbal clue. All right, so yeah, this is something that needs to be followed. Okay, this is something that is very very important, and it's a basic of psychiatry. And also, you may have to use this in these stations where you're dealing with abuse cases. Okay, we're going to discuss the abuse cases later on in the course, but since right now, since we are at psychiatry, we are going to discuss the psychiatric cases one by one in the upcoming lectures. Okay, so that's it, pretty much it for today's lecture. If you've got any queries regarding the non-verbal clues, then drop them down in the comment box or reach out to our socials. If you have any other queries and if you want to get them addressed, and if you want to one on mock with us, then please scan the QR code and sign up, and then my team is going to schedule a mock. All right, so that's it for today. Let's meet in the next lecture then.